Let's study myringoplasty. Myringoplasty is the operation in which the whole of the tympanic membrane or the eardrum is repaired. Here we can see the hole in the tympanic membrane which is being repaired by the operation called the myringoplasty. Aims or advantages of myringoplasty are: it is used to make the ear dry, that is permanently stop the ear discharge, and myringoplasty is used to improve hearing. It is also used for occupational purpose as required in the military personnel or in the pilots. It is used for recreational purposes as for swimming or scuba diving. It is used to prevent complications due to perforation, to wear a hearing aid. Common graft materials used in the myringoplasty are temporalis fascia, which is the most common, then tragal perichondrium, areolar fascia overlying the temporal fascia, cartilage, vein, and the periosteum. Why temporalis fascia is the most common graft used in the myringoplasty? Because the basal metabolic rate is lowest in the temporalis fascia. It is easily harvested by post-oral incision. It is an autograft, so there is no rejection, and the thickness of the temporalis fascia is as normal as tympanic membrane, is the same as the normal tympanic membrane. Large size graft can be harvested, and it provides good resistance to the infection. Two causes of the graft uptake failure after myringoplasty operation. Here we can see in myringoplasty the graft is being inserted. So graft uptake failure, the causes for the graft uptake failure is the if we use the improper technique or improper graft preparation, and if there is infection. The techniques used for myringoplasty are the underlay technique and the overlay technique. Underlay technique. It is called underlay as the fascia graft is under the anterior annulus. It is supported by gel foam in the middle ear to prevent medial displacement. Overlay technique. In this, fascia graft lies lateral to the anterior annulus onto the anterior bony canal wall. It is placed medial to malleus handle to prevent lateralization. The conditions in which myringoplasty cannot be performed are the if there is active discharge from the middle ear, if there is nasal allergy, if the patient has otitis externa, if there is ingrowth of aqueous epithelium into the middle ear, when the other ear is dead or not suitable for hearing and rehabilitation, and when the children is below 3 years of the age. So in myringoplasty, it is an operation to repair a hole in the eardrum or the tympanic membrane. Here we can see the hole is being repaired by using graft, and its aim is to make the ear dry, to improve hearing for occupational purpose in pilot and military personnel, for swimming, for scuba diving, to prevent complications, to wear a hearing aid. And the common graft materials used are the temporalis fascia, tragal perichondrium, areolar fascia overlying the temporal fascia, cartilage, vein, periosteum. Why temporalis fascia? Because basal metabolic rate is lowest. It is easily harvested by post-oral incision. It is an autograft, so no rejection. And the thickness of the temporalis fascia is same as that of normal tympanic membrane. Large size graft can be harvested. It has good resistance to the infection. Causes of the graft uptake failure can be the infection and the improper technique or improper graft preparation. The techniques used are the underlay technique and the overlay technique. And the contraindications is that if there is active discharge, nasal infection, nasal allergy, otitis externa, when there is child below 3 years of age, when the other ear is dead or not suitable for hearing, and rehabilitation, ingrowth of aqueous epithelium into the middle ear. This is all about the myringoplasty. You can find these notes on the Telegram and the links are given in the description. Thank you.